Just one more person there, if we come in. So do you want me to stand up here, or do you want just gonna use Jaden, or it's just the cameras, I guess it's now.
You'll find them out.
Yeah, so,
You can't get away.
yeah, there you go, I don't,
Who's, I don't think we're missing anybody.
yeah, I don't.
I'm noting that, noted Jaden.
Yeah.
Should we turn off the recording, for this section, would you rather?
The control limit or no?
No, it'll be a very basic teaching, it's okay to.
You're okay.
Yeah.
Thanks for sharing, I just wanted to check.
Yeah, of course.
Yeah, yeah, no, it was nice, we got to see outside. So, yeah, Honey and everybody, welcome. Honey, no addition cost, perfect village draw, a quadruple dam. Just like, say, my name's Nolan Knott, I'm from Herb Lake, where you guys are right now. This building used to be, I don't know if you know the writer Drew Hayden Taylor, but he used to live here. And then they converted him into an education hub, so they really hosted appointments in here, and this is an area where we do a lot of trading, so. We also have a building back here from electrical trades and that. We met every now and then, so it's a really good place. It's off the reserve, so which was nice to get with. And I just want to introduce, this is Jaden. He works at the cultural center. He's a cultural coordinator, right?
Nishant Bad.
I'm not bad.
Yeah.
Right, so yeah, Jaden's been with us for about what, 6 months or?
Yeah, I think it started in last September.
September, yeah. Unfortunately, Donovan couldn't make it today. He got a job in corrections, so his guy's check came in early, so they pretty much have some stuff. I got up with Jaden and we watch. So Jaden's just gonna do a little bit of cultural teaching. It's just gonna be about smudging, why we smudge, and about medicines. Be it, so we watch. And there's an owl here, so.
Yeah.
Or you can be right here too.
Right.
And gave me a big enough piece of sand on it, so that for it help, of course.
We got you.
Oh, watch, Sean.
So on I'll go ask on vision policy can go on going from not know that. As Doug said, my name is Jaden Jacobs. I'm from Curve Lake and I'm part of the Turtle Plan. I just want to go into a brief teaching about we'll start off first about the smudge out there that we did and why we do that. So the medicine we used to smudge was sage, and sage, when we burn it, we use that smoke and we grab it and there's no right or wrong way to do it, but a lot of people like they'll get you to bring it to your mouth, bring it to your nose, bring it to your eyes, to your ears, to your heart, and that's to cleanse you and make sure you walk in that good way. You're speaking good, you're smelling good, seeing good, hearing good, and you have that good spirit in your heart. So yeah, that's why we like to start off with a smudge to, remove all that negative energy and come in with a good positive energy. Another medicine you can smudge with is sweetgrass. Sweetgrass, some people consider it a men's medicine. Anyone can use it, I think. It kind of works hand in hand with that sage. So sage gets rid of the negative energy and sweetgrass brings in that positive energy. And another teaching about sweetgrass is how it's usually braided. So when sweetgrass is like, by itself, it's flimsy and, and then when you braid it together, it's like a strong, hard to bend, hard to break. So that teaching is like, kind of like, I don't know, like people, like, say if somebody's, if you're going through a hard time by yourself, it's gonna be hard, but you got other people there with you to help bring you up and make you stronger. And another medicine I want to talk about is the tobacco. And I'm glad that, sorry, I forgot.
Thomas.
I'm glad that Thomas, gave me the tobacco, cause that's how we like to, start off teachings. Is, with tobacco. Tobacco always comes first. Tobacco is the first medicine. Tobacco is used, when you're asking for things, like if you wanna, seek that knowledge or if you go hunting or something. You always give that tobacco as like an ask for whatever you're searching for. Another way you can use tobacco is with sacred fires. If you guys know what sacred fire is we do it for a lot of reasons, but the main reason is when people pass away in our community, we do that 4-day fire to help them get to that other side. And while that fire is going on, there's always a bowl of tobacco, and we ask that, you know, people, if they want to, come grab a bit of that tobacco, they put their thoughts into it, put it in that fire, and it sends it up to whoever they're trying to speak to, or if they're just trying to speak to the creator. And along with that is cedar. There's also a bowl of cedar there. And cedar is another one of the medicines. And but a little bit of that cedar in that fire as well with the tobacco, and it makes like a very distinct crackling sound. And that crackling sound is like to kind of like announce it to tell whoever you're speaking to that you're trying to reach them. Cedar is also used as a protection medicine a lot. A lot of people put cedar in their shoes, so you know they make sure that good path in life. Or even when we're doing sacred fires, a lot of the time the circle will be lined and with cedar to protection, keep those negative spirits out and make sure you know it's all good in there. That, yeah, that's pretty much it. Pretty much.
Yeah. And even
Oh, yeah, 7 grandfather teachings as well. So for the 7 grandfather teachings there, a lot of people like don't follow the order, but there actually is an order for the 7 grandfather teachings. The first teaching is love. And then the middle ones are all kind of like scrambled, so there's love, bravery, humility, respect, wisdom, honesty. And then the last one, yeah, and then the last one is truth. And we make sure truth is last because you know you have to know all those, you have to know and live with all those other grandfather teachings to know and live the truth. So that's why we always have truth as our last grandfather teaching.
And I think it was fitting that I saw a beautiful big turtle on my run this morning.
Yeah.
Here.
Yeah.
Right as I was rounding the current corner on the run, and I'll say, it had his mouth open, he's a snapping turtle.
Oh, really?
I never ran faster than that.
Yeah.
Yeah, thanks, Jaden, really appreciate it. Anine, Roundback, Viznikaj, Township of Selwyn, Doge Bob. Thank you, Councillor Knott, for arranging, for Jaden to come today and present to us, so thank you again. So we'll call the meeting to order, and are there any declarations of pecuniary interest? Seeing none, we'll move to the adoption of the agenda. Are there any amendments to the agenda, any additions? Can I get a motion to approve the agenda as circulated? Councilor, Mr. Maloney and Dr. Makicha, all those in favor? That's carried, thank you. Okay, adoption of the regular minutes. There was one note to be made that sorry, Francis Giroux was missing from the attendees list. And so we'll add that to it as an amendment. If not, are there any other changes to the minutes or no? Okay. For the motion to approve the minutes from May 20th as amended, Councilor Lucica and Councilor Royale. Further discussion, all those in favor? Carried, thank you. All right, business arising from the minutes. Is there any business arising from the minutes that everybody wants to bring forward? No? Okay, seeing none, we will move to item 6, which is medical officer of health update. Dr. Piggott is going to speak on those issues. Dr. Piggott.
Thank you, Chair Black. Thanks, Councillor Knott for having us in Curve Lake today, and I think that's fitting that we're here in Curve Lake First Nation during National Indigenous Peoples History Month, and coming up on Sunday is National Indigenous Peoples Day as well. So Nolan was telling me there'll be some great activities, events in the community here in Curve Lake on Sunday. So hopefully folks can check that out and learn some more.
Petroglyphs also. Yeah, well, Petroglyphs. We're hosting stuff and then either on Friday, is it?
Yeah, Friday you said.
Is there food?
Yeah, there's food. Actually, from our fish farm, we're getting, I don't know if you know who Bob Chibolo is, but he's on AFN, it's called Powwow Trail, he's a cook, he does chip trucks and that.
Okay.
Was on the circuit, right? So he's actually, cooking our fish that we grow, the tilapia. And our salads will be there too, our farm just opened up, so we're selling it at Foodland now, our salads, and then our fish will be going out probably in the next month. So we have markets in Toronto and all, so we're cooking actual fish then, so.
Congratulations.
Sorry to interrupt you there.
No,
Food always gets people to.
Yeah.
Very good interruption. Be glad for that.
Chance.
It's also Pride Month, so thinking about LGBTQ2S plus populations and celebrating Pride this month, super important. Especially given the public health connection and implications, both historically and today, with the need to recognize and acknowledge pride and equity for LGBTQ2S plus populations. I also, in my update, just wanted to share a few more things. One is you'll see in the package, we have sent a letter to the provincial coroner in response to the inquest on blastomycosis. And so I just wanted to highlight that that is really important, and it highlights the importance of our work to collaborate with First Nations and urban Indigenous communities in the region, and also from an equity standpoint to ensure that we're approaching issues of Indigenous health with significance and priority that they really require in Missouri. I also wanted to highlight that several of us attended the Alpha conference last week in Toronto, the Association of Local Public Health Agencies. So I was there, Deputy Chair Ryle was there, Larry Stinson and Carolyn, who are both in leadership positions within Alpha and the Association of Business Administrators, were there as well. So I'll speak briefly on behalf of the group just with some highlights, but I know probably Cecil might want to add with some of his reflections and thoughts as well. So it was a good 2-day meeting in Toronto. The agenda of the Tuesday last week included updates on disease projection burdens from Public Health Ontario. So there's some work that Public Health Ontario in collaboration with the U of T Della Lana School of Public Health done to look at projecting illness. And this is also data that we've drawn on in the community town halls that we'll use for our strategic plan, looking at the prevalence of chronic disease burden. And in this local region, in Lakelands, where we have the highest proportion of seniors in the province, we also are expecting to see a doubling in the rate of chronic disease over the next 15 years, which is a significant increase. So there was a presentation from them on that work and the work to come. There was an annual general meeting, and all of the resolutions that were in your May package were passed with some minor amendments. There was a presentation on the political landscape and how that relates to public health from a consultant. Certainly, the key messages shared there were Healthcare is still important. It's sort of second most important issue after cost of living in the province. And that both homelessness and public safety are really rising issues. And so there's some insight, I think, to draw from that on how public health can really influence and message up to the provincial government. We also had presentations on the future of funding uncertainty in the provincial context from a public health standpoint, and how public health needs to do more to articulate the return on investment of the important work that we do. You know, that old adage, an ounce of prevention is worth a pound of cure. The math works out, but we do need to do the work to analyze and message out on that. There's an update from Dr. Moore, the Chief Medical Officer of Health, sharing about a lot of the emergency response work that's been happening to fires, floods, outbreaks, including hantavirus, Ebola preparedness, preparation for FIFA, and the context for public health in Ontario. So there was a great presentation around that and public health issues in Ontario from Dr. Moore. On the second day, there was a division of the Board of Health section of the meeting, which Cecil, Larry, Carolyn attended, and some discussion there on appointments, public health authorities, accountability, health promotion, the connection to the Association of Municipalities of Ontario, AMO, and work for high impact boards. I attended the Council of Medical Officers of Health meeting, and there was a further discussion on the future of public health in Ontario, and some good ideas around how we can collaborate, lead, and really work with the provincial government and public health of Ontario to have the biggest impact possible for the health of Ontarians. So before I speak about the last couple of items, which is just reviewing Ebola and hantavirus at a high level, I'm just going to pause and see if Cecil wanted to add anything about the conference. So,
Councillor Royale, are you?
Yeah, I tell you, it was my first conference, and I was very, very impressed. I learned more than I thought I would, and I hope I remember half of it because it was all good. The thing that impressed me the most, though, was when we had the meeting with Dr. Moore, where he presented to all of us, and he kind of told us that the overall positioning of healthcare agencies within the province is really starting to communicate more effectively at the upper levels. Whether that's going to result in any realignment of anybody's responsibilities, he didn't go into that. But what he did say is that there is a great need to communicate effectively amongst all of the healthcare people, that people with it, helping the aged, those in the hospital, remedial care, those in the prevention care, like us. And he also recommended that if there was any opportunity for us to meet at our level, it would be a good thing, because he was also indicating that the province's position on frugality, if that's a word, is not going to change. And at the end of the day, we may have to look at how we can do things in a slightly different way to accomplish what we all want to do, which is provide better health across the region.
Thanks, Councillor Royale. You want to finish and then we'll take questions?
sure, yeah,
Okay.
sounds good.
Sure.
And so I
Thank
think,
you.
I think the message at a high level for both hantavirus, given that this week we passed the incubation period for those who are isolating after the MV Hondius outbreak of the virus, the strain of hantavirus on the cruise ship that was out to Antarctica. In our region, we were fortunate to not have any work of following up cases or contacts, but across the country, there was that work by public health. And I think the fact that we haven't seen that onward transmission, it's important to underscore that's a success story of public health, both from the World Health Organization all the way down. That hard work was critical in contact tracing everybody and ensuring that there was no onwards transmission. And I think that's often a story of public health, is that quiet work in the background that does prevention work that's critical. The Ebola context continues to evolve. So a reminder that the Bundibugyo strain of Ebola virus is one where we unfortunately do not have a vaccine or approved treatment. And that differs from the previous outbreaks of Ebola in recent years, where we have had that authorized vaccine. Ebola is a virus that can be very fatal. It's been classified as hemorrhagic fever. It means people can present with very severe fever illness and then have bleeding issues, require intensive care unit support, and often has a high mortality rate associated with it. While the mortality rate appears a little bit lower, closer to 17% for this outbreak of the baby Bujio virus strain, lower mortality rate than for previous Ebola outbreaks, that's still significant. And it's sadly happening in a part of the world where there is very limited access to high quality healthcare and some of the tertiary care supportive services like ICUs that are needed to save lives. So that outbreak continues. There are significant capacity challenges on the ground. From a global health standpoint, I think it's very important that there's support and solidarity of the communities affected, because we know that viruses can travel and that could put Canadians and people in the Lakelands region at risk. The federal government has decided to impose a quarantine and restrict travel from individuals. That will limit the number of individuals that potentially could come, and there's active screening happening at the borders at this stage. So there is some work at a preparedness level that we've been asked to do as a health unit by the provincial government, who is working with the Public Health Agency of Canada, leading preparedness and response to the outbreak. At this stage, there are no cases in Canada. There have been no cases of hemorrhagic fever in Ontario before, but we're doing work to prepare in the event that we potentially had a case. But again, I think this taken together underscores the higher frequency and severity of these emerging and re-emerging infectious disease threats, and the need for us to continue to be ready, be prepared for whatever lies in store in the future, because we don't know when the next one will be the next big one. So that's the message that I just want to leave the word with, and I'm happy to take any questions.
Thank you, Dr. Pickett. Any questions for Dr. Pickett on anything? Dr. Stelzer, go ahead.
Through you, Mr. Chair. Cecil mentioned mentioned frugality, and I'm just wondering, is Alpha prepared to have some sort of formal statement as to what kind of funding we can expect in the future, i.e. some reasonable increases that meet the demands that we have, or are they expecting nothing and we just have to tighten our belts and become, in quotation marks, more efficient?
You want me to start?
I wasn't at the meeting, so I can't.
Sure, maybe I think the tone of the conversation from a finance standpoint, through you, Chair, was very much one that we know that public health units need at least inflationary increases from funders. It's we've been living in a context of austerity funding measures for over a decade across multiple stripes of government, right? 6% increase in 10 years is about 22% less than what inflation has been. And so that means we have almost a quarter less capacity than we did back then. When you look at the funding increases that just sustained funding would be. When you look at other sectors, hospitals, et cetera, they are getting those 4, 5, 6% increases that are commensurate to inflation. And so therefore there's a widening gap. I think continuing to advocate that public health is an investment and will help to prevent some of the chronic disease challenges we'll be faced with in the province in the next couple of decades is really important, and that more immediately help with the government priorities of primary care and attachment, can help with the priorities of reducing strain on the acute care system, keeping people healthy out of the emergency departments is a saving cost savings eventually. I didn't hear any specifics coming out, and nor were there resolutions on funding, but I know there has been long-term conversation on advocating for at least a sustainable increase to public health. I would think that it would be important to continue that conversation for those that want to share it back to Alpha or want to bring that to other venues, perhaps the annual meeting in August or otherwise. I think there's a real opportunity to continue that dialogue, so that we don't just sustain or maintain public health capacity, but we actually grow it given the need to prevent more over time. So those are some of my reflections and thoughts, and I see Cecil also has a hand up, so maybe there's context from this comment.
Sure, Councilor Rad, go ahead.
Yeah, I think that that Dr. Piggott pretty well summed it up in what we were talking about. There was an open discussion too amongst all of the members of the health units that were there, and they were all of the same opinion. There needs to be some kind of I'm not sure whether you want to call it a coalition or you want to call it some kind of a getting together to just look at the overall positioning, because the amount of money that's going into remedial health, obviously, because it has to be done, is outstriping what we do. And yet, if they funded us effectively, half of the remedial stuff might go away. And so there was a genuine concern right across all of the health units that had representatives there that something needed to be done, and what exactly, that was the question. Nobody seemed to have a direct answer. Again, this goes back to my concept or terminology of the frugality of the province, and that they're putting money where they see it's necessary, not necessarily where we see it's necessary, or possibly even the healthcare agencies combined. So I don't know what the final solution is, but I think Dr. Piggott pretty well summed it up.
Councilor Real, yeah, just making a comment myself with respect to the advocacy work that we've been doing. Unfortunately, I couldn't make it to the conference this year. I was away, but it's music to my ears that it's even being discussed at this level at the Alpha meeting. There was not a word of discussion around funding last year. We have rattled some cages over the last 12 months that public health units need to be a stronger voice, a stronger advocacy for funding for public health. As Dr. Piggott said, 6% over the last 10 years is not sustainable. Municipalities have been picking up the difference, and First Nations have been picking up the difference in most cases. As you all know, it's the formula is supposed to be 75% province, 25% public municipalities and First Nations, and it's at 68% and 32% at this point. So I think it was, again, music to my ears that I was wishing I could be there to listen, but at least it's a topic that's being brought forward, and you know, people are more aware that the current situation is not sustainable. We learned a lot of lessons through COVID, and the lesson we learned is you can't continue down that path and expect better results when you're constantly putting that kind of pressure on budgets and staff. So thanks for the comments on that. Dr. Stelzer, is that good?
Yeah, for you, Mr. Chair. So how does that affect our strategic plan then? Are we going to just decide we'll get 1% funding for the future, and how are we going to allocate that in our strategic plan, or what adjustments are we making to our plan?
At this point, we don't know what the budget number is for next year yet. Again, we're hoping the advocacy that's been going on and an acknowledgement at that conference that it's a problem that they have to deal with. I'm hoping that it's not 1%, it's more than that, obviously, but we don't know at this point. It's really hard to make, you know, a comment on what the strategy would be. You know, we're trying to maintain and improve public health. So it's yeah, it's a double-edged sword, right? When funding's not there and how we manage that. So we'll have to wait and see a little bit longer before we find out what the budget number is for next year.
Okay, thank you.
Briefly for you, Chair, we're working on the early phase of developing the 2027 budget and thinking about scenarios for that and variables. So those scenarios and that discussion will come to the next fruition.
Thank you. All right, any other questions? No? Not seeing anything. You get a motion to receive Dr. Piggott's update for information. Motion that passes, Grill and Dr. Beechin. All those in favor? Thank you. All right, we'll move to item 7, which is reports. And there, 7.1 is a presentation on tick surveillance and Lyme disease update. I'll ask Dr. Piggott to introduce our speaker today.
We have Dr. McCarthy here, who's a 5th-year public health and preventative medicine resident in the University of Ottawa that was on for 6-month rotation with me last fall, and is back for another 3-month rotation currently. And he's going to speak on behalf of the Environmental Health and Infectious Diseases Division We also have Anne Marie Holt online and Richard as manager here in person with us. So I'm going to turn it over to Dr. McCarthy for the presentation on a topic we probably get a lot of questions on. And certainly ticks and Lyme are on the mind of a lot of people in the community right now, given the changes. So we'll look forward to the presentation.
Thank you, Dr. Pigott, and he's happy to see all of you again to return. In particular, I'd like to thank Manager Richard for helping create the presentation and provide me with feedback. So today we're going to talk about tick surveillance in Ontario and then focus on our own health unit, the benefits of active surveillance, which is where we take nets and drag and collect ticks, and how we've improved on this, where we're selecting sites to do active and passive surveillance. And this helps create an evidence-informed selection so that way we use our dollars in the most efficient way. And then talk about next steps on how we will use this to inform future surveillance. Overall, this is a recommendation for the board to receive this presentation as information. I'm not sure if we can see the full diagram, but if you're able to.
There we go.
So we know that climate change is real, it's happening, it's changing in our environment. The geography of the animals keeps moving. As deer populations move northward, ticks follow. At a fairly fast rate, 35 to 40 kilometers per year on average. The tick we're most concerned about is the black-legged tick, or deer tick. You can see from 2022 to 2025, we have a near doubling of Lyme disease cases, which are the primary infection we're worried about in these ticks. Unfortunately, it's not the only infection. You can get babesiosis, anaplasmosis, Powassan virus. And due to these other infections, Public Health Ontario took the role of including surveillance of all 4 of these now since 2023. Now, what can we do about Lyme disease? We can diagnose this, we can treat it, we can also prevent it. Not every tick bite causes Lyme disease. So we have a picture of the tick, although we had a live tick on your desk too long ago, Dr. Pigott. But if you have
In a
a
jar to be clear. In a jar to be clear. From my daughter, removed from my daughter.
yeah. However, on average, if you have a tick, about 20 to 30% will have Lyme disease. That's how prevalent they are. If you have a tick attached for more than 24 hours and it's large and engorged, we do worry that someone has contracted Lyme disease. So that can be treated with antibiotics, usually doxycycline, if we can see someone in the first 3 days. If we don't see someone that soon, they can develop other symptoms, aches, malaise, fever, and eventually a potential rash. On the far right, we can see what's called the bullseye rash, which is very indicative of Lyme disease. So we want to prevent this because of damage to the heart, the nervous system, and arthritis that can develop. The nervous system can have facial weakness, nerve pain, or even meningitis where you need to be hospitalized. For joints, they become quite stiff and painful, and you can have an arrhythmia or change to your heartbeat. So these are all conditions we can prevent if we are able to track ticks. We think about priority populations, children outside who need help with tick checking, outdoor workers. And it's also prudent for a health unit to think of health equity, those who may not access the information they need to do the tick checks, as well as repellents to prevent ticks on. So looking more back at surveillance, our health units primarily do active surveillance with the tick nets. I'll show you a picture of that in one of the slides. But we can complement this now. We now have citizen-based app called eTick, which you can download. It's used across the country where if you take a photo of the tick, you don't have to keep it. It can be speciated, and then now we have active participation of civilians. And so what the environmental health team did was, well, maybe we can combine the two. And if we do that, that can give us an evidence-informed way for where to do tick dragging. And so active tick surveillance helps us identify risk areas for Lyme disease. We're always trying to find that border of where it's heading next. We can track the spread of different populations of ticks. The Lone Star tick is another one that's slowly making its way up northward from the US. Monitor for different species, and then that helps inform our messaging and how we can help people stay safe. So with Richard's guidance and 6 other members of the team, they came up with a way to combine the passive surveillance with the active surveillance that we've been doing. And these are the team members that were involved. Oh, and just to mention, that's the tick dragging occurring right there. And so you could easily see a tick on that white background. The team reviewed the risk map of where it's endemic or where we see tick and Lyme disease already. And then they created an operating procedure to combine the passive surveillance with this active surveillance. This is a bit of detailed data, but what it shows you from eTick is we know the species where it was reported, longitude, latitude, and so that way we can actually map it and combine it with Public Health Ontario mapping. So on the far left, we have the citizen eTick or passive data. And it's unique with the hexagon grid created by our team here at Lakelands. Darker brown shows the areas where citizens are reporting ticks more often. On the far right, we have our Public Health Ontario data for our health region where we have that active surveillance. And if you can appreciate just on glance, there are some differences, and that's what helps inform us on where we can do the tick dragging. But the darker brown is where we have higher reports of people reporting ticks. And so the environmental health team requested the eTick data. We got special permission to use it internally. And then Public Health Ontario helped Curtis Russell with managing it. There's some mapping software that was used. This is a little bit beyond the technical knowledge that I have, but Richard will able to help us. But you can appreciate on the far right that collecting that eTick data created new clusters that we hadn't seen before in purple. So this is the magic part, is when you combine the two. So in maroon, we have the active surveillance from Public Health Ontario. In blue, we have the passive surveillance from the spring and fall from eTick. And in yellow or orange, we see these little dots. These are spots where citizens are reporting, where we could be considering our our tick dragging for this season. And that's what informed where they've been active this year. Just to show you, so the group is active in Halberton County, City of Portage Lakes, Peterborough County. And through those areas, they were looking at the woodland habitats, heavily used trails where people are active outside. I won't go through all the detailed locations. You can read those off the slide, but in Halberton County, we have 4 forested regions and trails that we were doing active surveillance. City of Portage Lakes, 6 that were included. In Peterborough, we have 5 different trails and regions that are part of the tick dragging. Curve Lake First Nations was visited not too long ago. And to share our thanks for being here and participation in Curve Lake, we're also highlighting specifically Curve Lake's risk. So from 2025 to 2026, this is now a higher risk area where tick bites should be taken more seriously, and keep checking children as well to make sure that they don't have any ticks. So from this data, Lakelands is able to achieve 4 objectives. The first is we can conduct surveillance in areas that are not determined to be high risk in the spring and fall to help the provincial risk map as the geography keeps climbing. We can reassess high risk areas. We don't do them every year, but every 3 years. So we'll be going back to Northumberland County, for instance, in 2028. This helps us collaborate with local partners to expand tick dragging in other regions and provide education and awareness about tick-borne diseases in our community. And with that, I'm happy to take questions.
Dr. McCarthy, questions?
Here, could I just add one thing?
Sure, go ahead.
Just one thing to underscore is I think through this presentation, we really wanted the public and the board to understand the deep work our teams do on preparedness, on surveillance, on prevention, but also don't want to instill a fear of ticks and Lyme. That's I think healthy awareness is important, but don't want people to be scared of being outside and being out in the outdoors, because from a public health perspective, that is so critical for many other ways. But as these black-legged ticks have expanded and are ubiquitous in our region now, we need to be normalizing checking ourselves for ticks all the time. And there's some joke around the one that identified on my daughter, but fortunately that one was identified the night after we were up in Canoeing in Halliburton County. And so we removed it and no health, no harm afterwards. So I just wanted to underscore that nuance just around time and nature, I think still so critical, time outside, but we have to check for ticks on it.
And thanks, Dr. Piggott. We have Councillor Ryall first and then Councillor Lachika.
Thank you, Chair. My question is just pretty simple. If I'm the general public, is there anything that I can do to assist in the control of ticks? Or is it almost like a purely climate change scenario where it's beyond the average person to really get into any kind of a control issue? But we have to stay with the remedial and proactive checking. Is there anything in between or before the monitoring and proactive checking that we can do to try to reduce their numbers?
Yeah, very good point, because when we think about mosquitoes, getting rid of stagnant water is something that everyone can do. I think the app, downloading it, participating in the citizen data is one way everyone can be involved. Richard, did you have any further ideas?
For reduction in the population of ticks, there's really nothing out there. I actually did look at some strategies that were tried in the US where they've added an insecticide to these rollers and they put like a feeding box in there for the deer and other animals to come and feed, and then they would rub their antlers and they would get that insecticide on them to see if that would help. Unfortunately, that wasn't something that we were able to get into Canada, and the effectiveness of it wasn't really that useful when they did the assessment. So for average homeowner, one of the things that you can do is have some sort of a barrier between forested areas or high grassy areas and your lawn, and that would be like a rocky or wood chip kind of barrier in between the property lines, and that just minimizes the ability for the ticks themselves to get across. Now, ticks do hitchhike on other animals, whether it's mice or deer or other critters, so they can always get picked up and dropped off in other locations as well. Not much that we can do, unfortunately, other than the other preventative pieces. Once you see it, make sure that you check yourself, check your children, grandchildren, and pets especially as well, and remove them as quick as possible. And then the other part of prevention is wearing long sleeve shirts, pants, wearing DEET based spray on yourself. And there's also clothing that you can purchase. It's permethrin infused. I know Mark's Work Wearhouse sells them, or you can infuse your own clothing. You just got to make sure that it's properly dried or thoroughly dried, because it is carcinogenic as well. So you can use it. The clothing that you purchase from Mark's Work Wearhouse is good for about 70 washes.
Richard. Councillor Lachika, I see your hand up. And then
Thank you very much, Chair Black, and thank you, Dr. McCarthy. It's great to see you here again, and for providing all of this important information for us. Just a question regarding the other 3 diseases that you had mentioned briefly. I heard a story about someone who had contracted Powassan. Can you just speak in a very cursory way just about those other 3? In terms, are they rare? Is it the black-legged ticks that carry those 3 as well? Just curious. Thank you very much.
Sure. So the other 3 are all still in the black-legged tick. We've only had reporting for 2 years, so the first, take it with a grain of salt, but anaplasmosis has also been increasing. A challenge with these 3 is, how do you differentiate them? If someone gets a tick on them, how do you know which one it is? It's quite difficult. for instance, the Powassan virus only requires 30 minutes to 1 hour of attachment to actually get in versus Lyme disease is that 24 hours. So awareness, education, nurses, physicians have to be more alert. And we don't have any antivirals for Powassan virus. So this is still an active area of research. We need more medicinal research, clinical research. There's other illnesses that we worry about, like Rocky Mountain spotted fever, but that one is not here and it's not in this particular tick species. And the other one is the Lone Star tick, which looks like it has a little star on it. We haven't had that yet here in Ontario, but it's starting to come to our region. Yeah.
Thank you very much.
Thanks, Councillor. Mayor Whipple? Oh, you're on mute there, sir. Oh, you're still on mute.
Is that better?
There we go.
Oh, thank you. I was watching the film and they were working on doing their testing on pathways and that type stuff, which I thought would be a good place to walk with your kids, but because the grass is low and the other things that I'm hearing. But am I false at thinking that?
Walking in short grass, Richard.
Yeah.
do you have ideas?
Yeah, no, that's what's recommended. So
Yeah.
it's recommended to stay on beaten paths, so there isn't a high grass area. I mean, that's the way to minimize the possibility of acquiring a tick. Because generally what a tick will do, it'll sit on some sort of vegetation and wait for a host to come by. So if the vegetation is low or non-existent, you're walking through that, much less of a chance of acquiring that tick or getting that tick on you.
Okay, and if I can follow up, Chair, golf courses and that type of stuff where people are out in the wilderness, but if they stay on the fairways and that type of stuff, is there less chance of getting attacked, and should be wearing, instead of shorts and everything that's comfy, should we be actually wearing long pants?
Well, if you're able to stay on the green and not get into the rough.
Yeah, sure.
Depends how good your game is.
That's not very likely for me. I can't keep on straight anyways.
Yeah, okay. Thanks.
Thank you.
for that. Okay, thank you, Mayor. Yeah.
Mr. Chair.
Yeah.
When you're doing the tick dragging, are you doing it mostly in public places like these pathways, or are you doing it on private property where there is long grass?
Since I'm not the one doing it, I will defer against to Richard, but I would assume this is public space. This is places we have permission to do the tick dragging. So,
Yeah, that's
Okay.
exactly, and we're trying to purposely target areas where general public has access to, so it's not just private farms somewhere and.
Just one comment from me, after reading the presentation the other day, I noticed there was an ad for some tick spray that came out about 2 days ago. Is that a thing where you could spray? I know you mentioned DEET sprays and stuff. Is there a specific tick spray that they come out with now? that you're aware of?
I've seen the same ad, I don't know much about
I
it.
don't know if it's true or not.
So
It's on the internet.
it's not something that I'm gonna endorse or not endorse, but I have seen the ad as well.
Yeah, okay, so possibly.
Maybe for next year.
Possibly something coming, so, okay, well, no other questions, don't see any other hands. Oh, sorry, more.
When you're talking about a barrier, I know back in the day, like, at least some of us still do it actually. To burn your grass, like we used to, so I still do down in homes, but yeah, we used to burn, make a barrier in your area and just burn your grass, and does that kill the ticks too? They don't like that.
Yeah, so the burning process would definitely kill the ticks.
But the black dead grass is that.
No, that won't kill the ticks, but it'll act as a barrier.
Yeah, that's what I was
Yes,
wondering, yeah.
So it's similar to what I was talking about with either having like a stone pathway or a dirt pathway or wood chips, that has the same effect.
Yeah, because we see that at the farm too, around the fence line, stuff, just to. No, I just.
Anybody else? Well, thanks, Dr. McCarthy and Anne Marie and Richard for the presentation, very informative. Thank you very much. Okay, can I get a motion to receive the presentation for information? And we have Councilor Lachika and Mayor Logo. All those in favor? That's carried. Thank you. All right, so we're moving into 7.2 Stewardship Committee Report, the draft audited statements. Dr. Piggott's going into the secretary.
Yes, and we do have our auditor here, so good evening, thank you through you, Chair. We do have our auditor here. Richard is online and available for questions. He wasn't going to do a presentation this evening because the Stewardship Committee just received that full-length presentation last week at the Stewardship Committee meeting. So the Stewardship Committee meetings recommended the audit to the board for approval. You can see it having been circulated with the agenda last week. The Coles notes that we received from Richard were that it was a complicated year for the audit, given in 2025 we had the merger, and that involved both some significant financial transactions, such as paying off a mortgage of the building, but also the integration of financial accounts, which is a complicated process. So our sincere thanks to the auditor and our finance team led by Larry and manager Dale for getting through that for us this year, and getting to a clean audit, which is the conclusion of the auditor, which is obviously good. So you can see our financial position there. I'm not sure if Councillor Ryall as Chair of Stewardship wants to add anything to the brief remarks that I made, but Richard's also here and available if the board has questions.
Councillor Ryall, you have anything to add?
Yeah, I think you pretty well covered it all off. Again, the complexity of the fact that there were still interfaces or residual impact from both of the legacy health units created some, I think if I said interesting gymnastics in order to get the numbers to basically read the way they should. But having said that, our people did it correctly, and hopefully we'll have nowhere near that level of complexity in 2026.
Good. Any questions for Councillor Ryall or Richard at this point? I'm not seeing any. Just a question, Richard, again, great job from the sound of it. I wasn't able to be at the meeting to give you a few questions to respond to, but everything looks great. Do you think the layout and the setup and the account merging is done? So next year there won't be potentially as many bumps to get us to the final numbers?
Yes, that is correct. That's our understanding. In speaking with your staff earlier this week, everything now has been combined into one general ledger, so that everything should come together smoothly for next year.
Okay, thank you. All right, any further questions? Larry, comments? You're good? It's all passed? You're good? Sure you are. All right, so we do need a motion to approve the 2025 audited statements as presented in the package. Then we have Dr. Stelzer and Councillor Ryall. Any further comments? All in favor? That's carried. Carried. Thank you. All right, so we're going to move to the consent items. There's quite a number there. Are there any of the items that anybody wants to hold and discuss separately, or we can approve them all together? Okay, give me a second here to look. All right, I'm not seeing anybody asking to have any of the consent items pulled. So we will need a motion to pass all the consent items as presented. Motions, Mayor Lobo and Mr. Maloney. Any further discussion? Seeing none, all in favor? Carried, thank you. Bendigo. Is there any new business anybody wants to bring up today? Okay, I'm not seeing anything. Then we will move to the in-camera session. Need a motion to proceed to in-camera to discuss 3 items in accordance with the municipal act. Exceptions have been noted on the agenda package. Thank you, Dr. Makicha, seconded by Dr. Stelzer. All in favor? All right, we are moved into camera. We'll need a second here to shut the YouTube off.